Inclisiran and, of course, LDL, which is the current hot topic. And so I'll just make a few comments as a surgeon. So for me, who is this high-risk patient or a patient where I'll be very concerned about managing the LDL? So for me, these are patients where I have done a bypass surgery under the age of 40. So these are patients who are at a very high incremental risk of need for re-intervention, be it angioplasty or be it a redo coronary artery bypass surgery. Despite doing multiple arterial grafts on young patients, still 15-20 years later, there is always a need for re-intervention. Thankfully, because of advances in angioplasty, majority of the time it is angioplasty. But to do a reoperation in a patient with multiple arterial grafts is not very easy and obviously very difficult for the surgeon and of course for the patient. So for a patient of this kind, we are very aggressive, and I think Inclisiran would be a very strong recommendation for that group of patients. The other group that we frequently encounter are patients with familial hyperlipidemia of all sorts, and again, this would be a wonderful drug for that. Still, it leaves us with some patients who are in the age group of 40 to 70, where despite rosuvastatin of up to 40 milligram, the LDL still remains above 100. So for me, these are the three broad classes of patients where I would use this kind of drug. And again, this is more a cardiology type of thing. So I would love to hear from the 3 or 4 people in our group right now. Yes, Dr. Dilip, please take over.
Yeah, so we like last 2 trials showed the feasibility of reducing LDL less than 30 and 20 even, and what's the kind of risk and benefit. So risk is almost nil. That is what we have come to a conclusion at this moment with all these trials showing that these are innocuous if we bring down LDL to even 15-10, and there was even incremental benefit which was seen in Fourier trial. Now coming to VICTORION-INITIATE, where we want the LDL to be knocked off very quickly after acute coronary syndrome. So I will also tell you a story of a lady who is admitted in my hospital waiting for corporate clearance. So the story of this lady was, she's just 39 years. Her husband works in corporate, and she developed MI 9 months back when she was in Bangalore. Then the primary angioplasty was done. 2 stents were put in, one LAD and one a circumflex. Then the patient came to me with another ACS event after 2 months of this event in Calcutta. So I checked the angiogram, the LAD circumflex stent was fine. The OM had a thrombotic occlusion. So I fixed that, and then I put this lady on Inclisiran. And because she had recurrent event, twice she had acute coronary syndrome, she was on high dose of statin, 40 milligram rosuvastatin, and antiplatelets, of course, ticagrelor or aspirin. And her LDL was around 72. So I thought, let's bring the LDL to around 30-40 for her. And I started Inclisiran. And after taking 2 days of Inclisiran, after 3 months it took, and then I got a call from corporate. Dr. Kumar, please don't write this Inclisiran. It is difficult for corporate to give the patient this much of costly drug, and you can avoid, then you start the other drugs and try it out. And so we skipped the next, or I think we were about to give, and she was not getting it. In meantime, she got admitted again 5 days back. We saw that the LAD, just prior to the LAD stent, there is a occlusion, which is 90%. And I'm really, confused what to do at this moment. And I'm again willing to restart Inclisiran. Now my idea would be keeping LDL less than 20 in this patient. And I'm going for a drug-eluting balloon angioplasty on Monday, because and that is what we got the approval. So these kind of patients, Dr. Nishant and Dr. Kalyan, you would be getting as well. So what do you feel Inclisiran to be initiated as early as possible in these recurrent events, like Dr. Pandey also, alluded to, young patients with kind of recurrent events, multiple surgeries, multiple stents, then would you wait for bempedoic acid or HTMI to work and bringing it less than 55, or you'd be straight away going for Inclisiran with Victorian-INITIATE kind of strategy?
So, I also see a couple of patients with young patients with rampant atherosclerosis. Until now, we have the limitation of giving to maximum dose of statin. Bempedoic acid has come in last couple of years, hardly makes 10, 15, 20% decrease further. Azithromycin 5 to 10% further. But still the LDL is high, and one patient who I have put on all three drugs and got a CT angiography done, calcium score is 1700 and LCXRC is 100%, LAD is 50%. So I've asked him to get permission for an angiogram and take permission for this. So this is kind of familial. Another advocate came yesterday. His father got a bypass surgery at 45. He is 45 now, got a CT angio done, calcium score 1800 with a LAD of 90%. So I'm admitting it for angio, but these are the patients who have a family history at very young, a father having MI or a bypass surgery at the age of 40s. And again, they are also facing the same trouble at the same age.
Correct.
So this is probably familial hypercholesterolemia and presenting it too early.
In UK, this is being pushed like anything, and they are, I think, trying to get it approved in preventive cardiology setup, where patients for primary prevention, they will be given this Inclisiran. So NHS can definitely afford it. Unlike in India, it's really difficult to afford. It's a costly drug, but this, I think, is very promising molecule, and in future it will be used more and more. Dr. Kalyan, yeah, so your points on this.
Yeah, I had one patient of age 22 with single cell disease with PTCA, but his LDL is around 400 something. We give all statins, everything in a maximum dosage. Then even then LDL is around 250. We advised to start Inclisiran, but the patient's affordability is an issue.
Yes.
Actually, can I add? I'm Dr. Pankaj Jariwala from Hyderabad.
Dr. Pankaj, when did you join? We missed you all along.
Yeah.
Yeah.
So thank you, sir. Actually, I was busy in angioplasty, sir, just now.
Right.
Actually, the doctor, what he's telling, actually, there are two types of homozygous familial hypercholesterolemia. One is LDL receptor positive and one is receptor negative. So Inclisiran will only work when there are LDL receptors are there. Because the mechanism of Inclisiran is it prevents the degradation of the LDL receptor, and it tries to increase the LDL receptors on the surface. So then only this will work. Otherwise, it will not work actually. Another therapy is apheresis, plasma apheresis in such a familial hypercholesterolemia, where you can, but that you have to do, you need to have special filter and all. I think Dr. Iyengar in Bangalore, I heard that he does this kind of treatment in such kind of cases. So
it's like this dialysis, there is some changes they make, and then they could do it, plasmapheresis.
yeah,
The commonest one is LDL receptor positive type, and majority of these cases it works. But it is pertinent to know whether this drug is going to work or not. But I have seen patients coming down, their LDL coming drastically down in 5 to 6 days even. If you start this drug, 10 days, 15 days, and LDL is, nowhere to be seen, very less. It's a very promising drug, and this is a Victorian-INITIATE. They did not wait for other two drugs to act, and they started Inclisiran, and maybe we see how the results will be in future.